Hello everyone. This video is recorded and prepared by student Shifa Fanasha as a part of first assignment requirement for disability occupation and participation course within the doctoral program in rehabilitation at the Arab American University under the supervision of His Eminence Dr. Muhammad Nazal. The assignment is related to the international classification of functioning, understanding the concept. And we will start with the definition. The International Classification of Functioning, Disability, and Health, known more commonly as ICF, is a classification of health and health related domains or areas. As the functioning and disability of an individual occur in a context, ICF also includes a list of environmental factors. For more explanation about the connection between the ICF and the concept of disease, disability, participation, and impairment, which is shown in the diagram, the ICF connect disease, disability, participation, and impairment through a comprehensive framework. A disease such as a stroke is a health condition. It does not define a person functioning on its own. Impairment are problems in body structure or functions, like muscle weakness or speech difficulties. When these impairments limit a person's activity or restrict their participation in daily role, such as working or socializing, and are compounded by environmental or personal barriers, this results in what we call disability. The ICF allows us to analyze all of these aspects together, moving beyond a purely medical model to a more inclusive, function based approach. The ICF model. The ICF model or framework begin with a health condition such as stroke or spinal cord injury, which serve as the starting point. From here, we evaluate the individual functioning at three levels. First, body functions and structures refer to a physiological functions of body systems and anatomical part. For example, muscle weakness or joint stiffness. Second, activity refer to the executions of tasks like walking, dressing, or eating. If a person is unable or has difficulty performing these tasks, it is called an activity limitation. Third, participation means involvement in life situations such as working, going to school, or social engagement. Participation restriction occur when the person cannot take part in these roles due to their condition or environment. Surrounding these are contextual factors which include both environmental and personal factor. For the environmental factors such as accessibility, social support, or healthcare services, while the personal factor related to the age, motivation, education, and coping style. The ICF emphasizes that disability is not only about the health condition, but also how personal and environmental factors interact with impairment to affect everyday life. Case study related to Luna, a 33-year-old physiotherapist and university lecturer, underwent an emergency appendectomy due to acute appendicitis. Although the surgery was successful, an incorrectly administered epidural injection led to complications followed by general anesthesia. Within 48 hours, she developed worsening numbness and tingling in her right lower limb. significantly affecting her ability to walk, stand, dress, and perform daily activities. Once highly active and independent, Luna now depends on others for basic mobility and care. Her professional awareness of condition has contributed to increase anxiety. She is currently undergoing outpatient physiotherapy and remains highly motivated to recover and return to her teaching role and active lifestyle. For this case, if we want to explain it by using the ICF model, the health condition for a primary diagnosis, post-operative complication following appendectomy, secondary condition, lower limb paresthesia due to epidural anesthesia, onset acute post-operatively for lumbosacral nerve root damage. The body function and the structure, there was sensation of pain, persistent tingling, numbness, and burning pain in the right lower limb. Touch functioning, decreased tactile sensation in the foot and lower leg. Gait pattern functioning, alter gait due to sensory deficit structure of lower extremities. No structural damage, but alter neurosensory conditioning and muscle power function. Mild reduction in right leg due to disuse and alter weight bearing. For the activity, walking can only walk short distance with assistance. Changing basic body position, difficulty in standing from a chair without supporting. Washing on self, need supervision for lower body hygiene. Dressing, difficulty putting on pants or shoes due to sensory disturbance and balance issue. According to the participation, recreation, and leisure, avoid physical or social activities involving walking or medical leave. Unable to return to work as a university lecturer. Family relationship relies more on spouse for mobility support. Acquisition of goods and services cannot shop independently due to unsafe ambulation and driving. If you want to explain more regarding the environmental factor, health services accessibility for the rehabilitation services not easy to reach, and some barriers in her working environment. There were many steps and stairs without elevators. And for the personal factor, she is 33, female, physiotherapist, university lecturer, active prior to the surgery, psychological profile motivated but anxious, coping style, emotional resilience by seeking resonance. Thank you for listening regarding the definition and the concept of the ICF and the ICF model.